Français. Hello. My name is Tiffany Newby. I'm an Indigenous nursing student at the University of Regina. Today, I will be exploring the importance of culturally safe care in improving Indigenous health outcomes with a focus on chronic disease management. This project was completed as part of Nursing Research 209. I will begin this presentation by smudging, a sacred Indigenous practice for cleansing and promoting balance on physical, mental, emotional, and spiritual levels. The smoke from plants like sage, sweetgrass, cedar, or tobacco purify and generate positive energy. Smudging symbolizes healing and resilience within the community and the land. As we explore cultural safe care and Indigenous health outcomes, I urge you to recognize the significance of these practices in building trust and supporting healing for Indigenous people. Truth and Reconciliation Commission Call to Action number 18. We call upon the federal, provincial, territorial, and Aboriginal governments to acknowledge that the current state of Aboriginal health in Canada is a direct result of previous Canadian government policies, including residential schools, and to recognize and implement the healthcare rights of Aboriginal people. This image is of the File Hills Residential School, which serves as a reminder of the long-lasting effects of colonialism on Indigenous people in Canada. Residential schools and the 60s scoop systemically separated Indigenous families and communities, contributing to deep intergenerational trauma. These events continue to affect healthcare today, contributing to systemic racism and inequities. In fact, between 2019 and 2022, over 50% of Indigenous adults reported having at least one chronic illness, compared to non-Indigenous adults at 40.6%. These statistics highlight the link between colonial policies and current health disparities. In Indigenous adults in Canada, how do culturally safe healthcare practices influence healthcare experiences and health outcomes, specifically in chronic disease management? When choosing my articles to ensure that I selected relevant studies, I used search terms such as cultural safety, Indigenous health, and chronic disease in Indigenous populations. I focused on studies involving Indigenous adults and cultural safety in healthcare, excluding anything outside of these parameters. Ultimately, 5 articles were selected based on their relevance, focus on cultural safety, and examination of health outcomes in Indigenous Canadians. Let's briefly look at the studies. Patra et al. In 2022 found that high chronic illness rates in Indigenous populations and demonstrated that cultural safe care reduces stress and improves health outcomes. The study also emphasized the important role of elders in healthcare. Hole et al. In 2015 said that participants felt invisible in healthcare settings, and the staff trained showed limited effectiveness. The study highlighted the central role of extended families in care. King et al. In 2023 focused on urban Indigenous populations, finding that community involvement and elder facilitation improved healthcare experiences and outcomes. Jones et al. In 2024 explored the pandemic's negative effects on Indigenous health and noted the underrepresentation of Métis perspectives in healthcare research. Borwick et al. In 2024 introduced the two-eye seeing approach, blending Indigenous and Western healthcare perspectives, and addressed mistrust in the healthcare system while emphasizing storytelling and support companions. Here are the strengths and weaknesses found from the studies. So the strengths were use of CBPR. Many studies use community-based participatory research, ensuring that the community was involved. Inclusion of elders. So the elders brought valuable knowledge to the research process. And Indigenous-led research. So several studies were Indigenous-led, aligning with the community's priorities. The weaknesses were small sample sizes, because this limited the sample sizes to make it hard to generalize the findings. Self-reported bias. Many studies relied on self-reporting data, introducing potential bias. And they were mostly qualitative. Most studies were qualitative, which means that we need more mixed methods or quantitative research for a broader understanding. Now let's take a look at the knowledge translation and why cultural safety matters in Indigenous healthcare. It builds trust and engagement. Cultural safety fosters strong relationships, encouraging Indigenous patients to participate in their care. Respects traditional healing and community values. Indigenous communities rely on family and traditional practices. Healthcare must reflect this. Improving chronic illness outcomes, especially important for managing long-term healthcare concerns through respect and individualized care. Supports Indigenous-led initiatives. Policy and practice must be driven by Indigenous voices to reduce ongoing disparities. And education is key. Training healthcare providers and the public helps break down stereotypes and systemic barriers. Now let's take a look at the medicine wheel. It's a sacred symbol used by many Indigenous cultures to represent health and balance. It's typically shown as a circle divided into 4 quadrants, each representing different interconnected aspects of life: physical, mental, emotional, and spiritual. Each quadrant also corresponds to the 4 directions, seasons, elements, stages of life, and the sacred medicines. The idea is that well-being comes from balance in all 4 areas, and healing involves addressing the whole person, not just their symptoms. Nurses can help by exploring cultural identity and its impact on mental health. They can provide education on mental health issues and assist in navigating healthcare with respect. Nurses can incorporate traditional healing methods and provide access to elders and spiritual healers. They can promote smudging or prayer and offer culturally safe emotional support. Nurses can link individuals to Indigenous mental health resources and foster a space for storytelling. They can promote traditional diets and activities, integrate herbal medicines with conventional treatments, and educate Indigenous communities on disease prevention. Question number 1. In the studies reviewed, there is a reliance on qualitative research methods, such as interviews and focus groups. To explore Indigenous healthcare experiences, what are the strengths and limitations of using qualitative methods to explore culturally safe care? How might these methods be improved or complemented by quantitative research to provide a more comprehensive understanding of healthcare experiences among Indigenous populations? And I responded with, qualitative methods such as focus groups and interviews are effective to capture individual, in-depth experiences. With that being said, they may introduce subjectivity. To improve this method, it can be used along with quantitative to assess health outcomes and create a better understanding of experiences. Question number 2. Several studies in the review, including those by Hull et al. And Patra et al., highlight the importance of community and family involvement in chronic disease management. How might researchers creatively incorporate participatory action research or community-based participatory research to empower Indigenous communities and ensure that their voices are central in healthcare studies? What challenges might come in conducting these types of research, and how can researchers mitigate these challenges? To which I replied, researchers could include the Indigenous communities in assisting with designing the studies. They could help with research questions, methodologies, and making sure their voices are utilized. Challenges could be lack of trust or cultural dynamics. To handle these challenges, researchers need to prioritize building relationships, being transparent with the communities, and open communication with all involved. Question number 3. The studies emphasize the importance of cultural safe care, but the definition and application of this concept may vary across different Indigenous groups. How could researchers develop a standardized but adaptable definition of culturally safe care that respects the diversity within Indigenous communities? What innovative research methods could be used to measure the effectiveness of culturally safe care in improving health outcomes for Indigenous populations? In response to this, I said, researchers need to ensure that they are focusing on each community's cultural practices and beliefs. Research methods should be mixed methods and combine the qualitative information and the quantitative to assess health outcomes and evaluate if there has been any improvement in the care received. Question number 4. Many of the studies in this review use a mix of self-reported data and participant interviews. What are the potential biases and reliability concerns with self-reported data in Indigenous health research? How might researchers creatively address these issues, for example, by triangulating self-reported data with clinical assessments or community-driven health indicators to increase data validity? My answer to this question was, the data could include bias and thus affecting the reliability. Researchers can compare reports with clinical assessments or health measures for an improved understanding of health outcomes. Involving the members of the community could double as building trust too. And question number 5. The two-eyed seeing approach merges Indigenous and Western knowledge systems. How can researchers foster creativity in developing the studies that integrate both systems, especially in healthcare settings, where one system often dominates the other? What are some novel, culturally appropriate research methods that can ensure both Indigenous and Western perspectives are respected and equally represented in healthcare interventions? To which I responded, cultural practices such as storytelling, art-based approaches, and land-based practices are culturally appropriate and honor Indigenous people's way of knowing and include integration of science-based knowledge. Bringing both perspectives together can create an inclusive approach to healthcare that benefits Indigenous patients. Thank you for your time and attention. This concludes my presentation.